I welcome you once again to another study session in PHA 301, which we discuss pharmacodynamics. In the previous study session, we have discussed pharmacokinetics. Both pharmacokinetics and pharmacodynamics are two main components of pharmacology. Pharmacodynamics is often summarized as the study of what a drug does to the body. Pharmacodynamics with pharmacokinetics helps to explain the relationship between the dose and response, that is, the drug's effect. The pharmacologic response depends on the drug binding to its target. The concentration of the drug at the receptor site influences the drug's effect. Pharmacodynamics is the study of biochemical and physiological effects of drugs and study of mechanisms of drug action in living organisms, which include the action and the mechanism of drug. At the end of this study session, you should be able to explain the basic concept of pharmacodynamics. You should be able to discuss the various effects of drug on the body, describe the receptor binding activities and factors affecting drug response, and should be able to explain the dose-response relationship. Pharmacodynamics is the study of biochemical and physiological effects of drug on the body or on microorganisms or parasites within or on the body, and the mechanisms of drug action and the relationship between drug concentration and effect. Pharmacodynamics involves receptor binding, including receptor sensitivity, post-receptor effect, and chemical interactions. A drug's pharmacodynamics can be affected by physiological changes due to disorders, aging, or other drugs. Disorders that affect pharmacodynamic responses include the genetic mutations, thyrotoxicosis, malnutrition, myasthenia gravis, Parkinson's disease, and some forms of insulin-resistant diabetes mellitus. These disorders can change receptor binding. It can alter the level of binding proteins or decrease receptor sensitivity. Aging tends to affect pharmacodynamic responses through alterations in receptor binding or in post-receptor response sensitivity. Pharmacodynamic drug-drug interactions results in competition for receptor binding sites or alter post-receptor binding or alter post-receptor response. For every drug to have an action on the body, the drug must be able to bind on a receptor to exert its effect. So without binding to a receptor, the drug cannot exert their effect. What is the effect on the body? The majority of drugs they either mimic or inhibit the normal physiological or biochemical processes or inhibit pathological processes in animals. Or they inhibit vital processes of endo or ectoparasites and microbial organisms. There are 7 main drug actions, which can be stimulating action through direct receptor agonism and downstream effects. We can have depressing action through direct receptor agonism and downstream effects. We can have blocking or antagonizing action. We can have stabilizing action. And there can be exchanging or replacing substances or accumulating them to form a reserve. Direct beneficial chemical reaction, as in free radical scavenging. We can have direct harmful chemical reaction, which might result in damage or destruction of the cells through induced toxic or lethal damage. Undesirable effects of a drug can include increased probability of a cell mutation, which leads into carcinogenic activity. There can be a multitude of simultaneous assorted actions, which may be deleterious, and there can be interactions like additive actions, multiplicative, or metabolic. Then we can have induced physiological damage or abnormal chronic conditions. Looking at receptor binding, a receptor is what the drug binds to cause a reaction or effect. If the drug fits exactly into the receptor, then an excellent drug response results. It is these receptors that are responsible for the normal functioning of the body. Drugs that bind to a receptor but do not produce a biochemical or physiological change, they are called antagonists. And these drugs block or stop what normally binds to a receptor. The receptor site can be a part of the cell. It can be on the surface of the cell, or it can be within the cell. It could even just be floating in the blood, like the coagulation enzymes. Receptor is usually a protein when a transmitter binds to a receptor, bonding occurs between the drug and the receptor. There has to be complete congruity between the drug and the receptor for the reaction to proceed. This is known as a receptor fit. Some drugs do not fit exactly on the receptor, and hence they stimulate a response but not as much as the natural receptor fit, and this is termed as partial agonist. From the picture on your screen, you can see drug, which is the ligand receptor interaction, whereby a drug must bind to a receptor to have a drug receptor complex. What are the factors that affect drug response? There are many factors, starting from dietary factors, cardiovascular function, GIT function, immunologic function, the liver function, renal function, albumin concentration, stress, fever, starvation, behavior, alcohol intake, tobacco or marijuana smoking, the age, sex, whether male or female, pregnancy, lactation, exercise, sunlight, barometric pressures, diseases, infections, occupational exposures, and so on. We can also have body weight. Increased body weight might lead to an increased amount of drug that needs to be taken to achieve the same response. There are also many other factors that can affect drug response. Dose-response relationship. The dose-response relationship or exposure-response relationship describes the change in effect on an organism caused by different levels of exposure to a stressor after a certain exposure time. The dose-response curve is a simple XY graph relating to the magnitude of the stressor, that is, the amount of drug, temperature, intensity of radiation to the response of the receptor. Studying dose response and developing dose response models is central to determining safe and hazardous levels and dosages for drugs, potential pollutants, and other substances to which humans or other organisms are exposed. Dose response relationships generally depend on the exposure time and exposure route, whether inhalation or through dietary intake. Quantifying the response after a different exposure time or for a different route leads to a different relationship and possibly different conclusions on the effect of the stressor under consideration. This limitation is caused by the complexity of biological systems and the often unknown biological processes operating between the external exposure and the adverse cellular or tissue response. Thanks for listening. Bye.